नमस्कार, कैसे हैं आप? So today we normally speak about heart problems, the the emotional heart problems. We normally talk about the broken heart and how to heal with that, and uh, and that's pretty an exciting topic that we speak about. I write about, but today the topic that we are going to discuss on is not something emotional. It is something towards medical line. And as you know, I'm not from any medical background. Probably I wouldn't be able to speak on that. And even if I would do that, probably you're not going to listen to me anyways. So I have invited today on this very fantastic show on heart attack, prevention of coronary heart disease. I've invited a renowned senior, very, very, very senior professional, a leader, a very beautiful gentleman, Dr. Ramesh I Kapadia. I I would call him Ramesh Uncle. He's such a senior. He's such a senior in preventing heart attacks. So it's like, this medical term is very new for me. This medical term is not new, I would say. It is like I'm not really medically familiar with this term. So probably I would not speak much on that, or probably I would say something and the it would not really work. Anyways, so first I would like to give Ramesh Uncle's introduction, since it is something very, very crisp. It has to be very crisp, very precise. I would read it out for you. Dr. Ramesh I Kapadia, MRCP, cardiology, FRCP Edinburgh, is a cardiologist based in Ahmedabad, India, with a practice of more than 5 decades. He was trained in India, in the UK, and in the USA. Dr. Kapadia is known for his passion for primary prevention of coronary heart problems, and affordable management of coronary heart disease, that is CHD, without sacrificing the survival benefit. Dr. Kapadia is the father of the Universal Healing Program, that is UHP. Today, the 90 years old Dr. Kapadia is active in his second opinion cardiology practice. So Ramesh Uncle is on his journey towards 91 now, and then 100. And 5 decades of his experience, and is still practicing. And that's wow. And that's super wow. Number of patients, number of people he has saved. I mean, that's just awesome. Ramesh Shankar has also written a number of books, 11 books since 1991, and they were published by Navajivan Publishing House, which was established by Mahatma Gandhi. So, with this beautiful background, this very fantastic background, I would straight, he's just beside me, and I would just straight go to him and we'll speak about some very critical questions on heart problems, heart attack, and how exactly we can prevent them, we can make our lives better. So while we write about some emotional things about heart attack, not heart attack, it's like, broken heart, relationships, and everything. Today we are also going to talk about the real heart attack. So that is the first kind of a podcast. That is first kind of a talk that we would have. And let's get the ball rolling. So, Uncle, welcome to the show. Uh, People are listening to you today. People are genuinely listening to you. They want to listen to you. So they normally listen to me, and I would normally talk about. Let me just try giving some information about what this podcast is. So I write some very beautiful lines, some soft emotional lines on my podcast, and you might not have heard probably. I think after this, you would listen to it for the first time, and this is the podcast for the first time that I'm doing, and it's something very on a very serious topic. One of the podcast, of course, I did some of them as well. They were very pretty serious, and so yes, on medical ground, I think this is the first I'm going to start with. So, Uncle, I would like to ask you a few questions about coronary heart disease, about heart attacks. And my first question to yourself, and that is, how common is heart attack in India today?
Heart attack, in India is now all over the world. In India, it is number one. Heart attack is number one now in all over the world. India's and one number one, and that's why your topic today is extremely important, and that's why the topic that you have chosen today is of great importance. Now, let me know what more do you want me to tell you about the heart attack.
Excellent. Sure. Uh, I would like to ask you that what are the common causes or the main causes of heart attack?
Heart attack can occur in extremely healthy people, first of all, and he it can occur in people who have got high blood pressure, diabetes. But the most important cause of heart attack is in cause of family history, and it's important to know that you can get that a person can get a heart attack without diabetes, without blood pressure, without any known cause of any other disease. It can get a completely healthy person can get a heart attack. So for a heart attack to get, this is the most important thing that I've been thinking all these years, practicing so much for and thinking about it, that people still do not understand the importance of preventing heart attack, because they think that heart attack can occur only when there is some serious disease or something seriously wrong with the person. While the most important thing I have been telling all my patients now, that the heart attack always occurs in the persons who are apparently very healthy. People who go to the doctors now and then for one illness or another, and one illness or another, they rarely get a heart attack. People who are healthy, so-called healthy, they get the heart attack. And that's why it is very important to know that, let me explain to you that how important it is, as you said, that the heart attack is now number one in India, all over the world. At one time, United States was number one about 25 years ago. And now they have done some work in primary prevention, and I am a witness to that. because I go there every year for last 30 years, and I am associated through my son with a clinic which is world famous clinic, that is Cleveland Clinic, and I am associated with the Dr. Nissen, who is a world authority for primary prevention, and Dr. Tuzu. And we have seen at one time United States was highest, number one in heart attack, and now they have done the primary prevention, and now we are now number one. So we have to understand this problem of heart attack, and people still don't understand that. They just wait. They say, if I get some symptom, I will go to the doctor. That in heart attack, the most important thing I teach all my patients who come for heart attack, I tell them that I take the history, that the son who comes, a brother who comes, I take interest in them. After treating the person who has come for heart attack, I tell his brother, his son, that they should get checkup, very importantly, to prevent the heart attack and that can be done very successfully. So uh, I am so happy that you have now selected this very important subject.
Thank you, Uncle. Uh, so, I would love to, and of course, the audience would really want to listen to the reasons, the causes. I mean, of course, you did mention about the family, the family history. Um, that remains one of the most common reasons for getting heart attack. But with this note, are there any other reasons that people can think of and can? Because I personally feel that food habits, they cause heart attack. That is the common understanding among people, mentioning, okay, if you eat this or junk food or something like that and it increases your cholesterol, probably this can cause heart attack. So is this one of the reasons for heart attack, or are there any other kind of reasons that people should be aware of about the heart attack?
Yes, you talked about the most common thing, that the fatty food, s- eh, use of tobacco in any form, and they that really can be a cause of heart attack in people who are specially prone to get heart attack. So, uh, particularly tobacco in any form is a cause of heart attack, and a persons who are prone to get heart attack, the tobacco in any form can can be a cause of heart attack in very, very young people. So my emphasis, all the time is that when the person comes from a heart attack, people don't you first of all, at, at even at this age of 90, and have been practiced for 55 years in coronary heart disease, you'll be surprised to know that I'm still thinking about how important it is to understand coronary heart disease, because it is not a disease. It's not. It doesn't occur because of some reason. It is a very, very uh, very complex thing. I'm still learning. Will you be surprised to know I'm still learning, and I'm still seeing many, many. My whole at this time in my practice, I see people coming with, oh, I had a heart attack and I've been advised angioplasty, bypass surgery. And they come to my clinic naturally, they are alive and they've come. And they tell me that I had a heart attack only 3 weeks ago. And uh, now they say that uh, I immediately I should go for some angioplasty or bypass surgery. So these are the things, Now, y- now you will naturally like to know the whole thing in the common parlance for all common people for heart attack is that if you get a heart attack, the treatment is angioplasty or bypass surgery. Now that is the thing that I wish to make known to people, that this is completely, I would not say completely wrong, but it's completely, the it has been created by the present approach to heart attack by large number of cardiologists, that now the impression in the general public is that heart attack means angioplasty and a bypass surgery and so much of expense and whatnot. But the point is that once if you recover from heart attack, then to prevent the heart attack occurring again, some rules if you keep, then it can be prevented in large number of people. And I have got a very, very satisfying results and a large number of satisfied patients who still keep me busy because of my simple advice. They have kept well. So I don't understand. The whole fear of heart attack is because you die all of a sudden. That is the fear. And that dying all of a sudden of heart attack is there from the time when the heart attack came on the scene long time ago. People fear that if you get a heart attack, you die all of a sudden. Now we have got excellent treatment when person survives a heart attack, and they can lead a very long and useful life if they stick to certain discipline, certain simple rules, and continue the medical treatment, which is now very efficient.
So I mean, in not just myself, in fact, the whole audience, they would be more than happy and interested to understand what are those rules that can prevent a heart attack or can prevent uh, people from getting that heart attack, and how simple life can make them feel better, because we see these days a number of youngsters, even at the age of 30, 35. I think, I recently heard of somebody getting heart attack at the age of, I think, 21 or something. So it is like, it's too early to get this. So what are those rules, golden rules, I would say them?
I don't know how to say golden rules. The golden rule is that at a very young age also, you should get your blood checked up for lipid profile. And the lipid profile now, the cholesterol report. Lipid profile means cholesterol report. And in a lipid profile now, the culprit cholesterol is the LDL cholesterol. Some time ago, it was it was said that the HDL good cholesterol should be high to prevent the heart attack. Now it is understood that the LDL is the culprit cholesterol. LDL, The total cholesterol is divided into triglycerides, HDL cholesterol, LDL cholesterol, etc. Now, what we have to look at in the person who is prone to get a heart attack or who is not prone to get a heart attack, generally speaking, is the LDL cholesterol. And the LDL cholesterol should be always below 70 in the persons who have had a family history of heart attack. Then LDL in the youngsters also, right from the age of 20, 21, 25, we check up. They checked up in the United States, and they saw that if they had LDL cholesterol higher than 70, then they were given instructions regarding their diet, their exercise, and that way they could bring down the incidence of heart attack in United States, which was once number one. And after 30 years of 30 years of primary prevention program by Dr. Nissen and others, they could now bring down that the incidence of heart attack in USA is now much lower than what is now in India, number one. At one time, as I told you again, I emphasize again, many years ago, India had no heart attack. India was, quite down in heart attack. The type of living. So now my function is only simple. That when the person comes for heart attack, I immediately, after treating him, I request his son to get his lipid profile done, and once I see his LDL high, then of course the medical treatment has to be given for LDL, but that is not enough. He has to change his lifestyle also, especially if he is using tobacco in any form. That increases the incidence manyfold. Tobacco is almost, I would consider, a, a, a slow poison for cause of heart attack. Once you have a family history, tobacco in any form should be completely stopped. And that is so important that we have found. Now I'm telling about something which gives the strength, or gives the inner strength for the persons to change their lifestyle. And for that, we established a program, what is known as Universal Healing Program, in 1991. And that program also was, uh, I, I was, so, what I would say, again, I learned about that program also in USA from a doctor known as Dr. Dean Ornish. And he was also, Dean Ornish was a young cardiologist who was also seeing that every patient who came to the hospital with heart attack, they were all treated with bypass surgery or angioplasty. And then he took up a program in which he taught the people the lifestyle changes, the changes in food habits, and the relaxation techniques, and had an opportunity to see that program in 1991. And I was so happy to see his 40 patients learning the lifestyle changes and becoming, they all had a heart attack, but then they were all uh, so healthy with his lifestyle that I was impressed that how this young American had learned all this, which is basic. The whole theme was more akin to our Indian culture. But then I learned that he had learned this from a Indian rishi. And that, when I came back to India, I started doing, implementing that program with the help of a person who was so close to me, and he uh, enunciated this program in lines with the Indian uh, people, and we called it Universal Healing Program, because the program not only healed the coronary arteries, but they healed the whole individual. They became, less hostile, more friendly, and change their whole attitude, not towards towards their whole uh, life in all respects, in their business, in their relationship with in the family. And this was a great, for me also, great uh, learning. Okay, what a simple thing, but and we had an opportunity to practice this program with about 80 participants coming twice a week in a in a in a very nice atmosphere, and the whole and I began to learn myself how this and this program, which consisted of simple exercises, stretching and relaxation, stretching and relaxation. When you see the program, when you learn about our program, it has no complicated exercises or anything. It is such a simple program. Uh, I cannot really tell you how all simple things are very difficult to describe. I tell you, all simple things are difficult to describe, and and I have and uh, the number of people who have practiced it, and now it is on my website, that program. And the exercises, you will see the stretching and relaxation exercises. You stretch a muscle and then you relax it. You stretch that way you go on stretching the muscles from foot to the head, foot to the head, and then after relaxing, then you relax the whole body and lie down with the eyes closed for some time. All those appear so simple, but all that made them have a inner strength to change their lifestyle, and somehow they change their whole attitude towards towards the towards the life. They became they they became more they cooperated with each other. They you will be surprised to know, because the program has been going on for more than 3 decades, and they told me that the program helped them to increase their business. The program helped them in their own family life. So it and then let me tell you lastly that I had an occasion to meet a the Dalai Lama in 1991, I think. And when I I met him, I had taken his appointment, and because of little delay in my reaching him, because of the health of my brother, who also accompanied me, he introduced me, Dalai Lama. He introduced me to a person, a Lama, and he said that Dalai Lama said that he's my guru, and he doesn't come out of his house at all. and he does not meet people, but I would make a special recommendation to see him. So I met him, and I learned from him how my program is effective in so many other ways. That coronary heart disease was one, but he taught me, the Dalai Lama's, he said he's his guru, the guru taught me that during during practicing the meditation for his disciples, he taught them a visualization which we used to call visualization. Means we thought that the blocks in the coronary arteries were going and the coronary arteries were becoming healthy and all that. But the guru taught us, or told me, that during the savasana or meditation, we taught them that he thought about the people who were who were actually they're I wouldn't we say they were not friendly to them, or they were actually he said that they were not the enemies or the, but we told that he said that we taught them that they get well. They're people who are not who were actually he used the word that they were not friends, but they were enemies. But they thought about the wellness of the person who are not their friends, and that helped not only them who are not their friends, but the people who are praying for them, that helped them. So that is, so he taught me that if you teach your participants who in their uh, savasana think that their arteries are getting open, or they're getting more and more, the heart is getting better, more circulation, better but if you also add to that that I would not say the word enemies, but people who are not friendly to them, of your, even if they think about their wellness, then not only they will be benefit, the other person will benefit, but also they will benefit. So I learned from them, learned from that guru, that lama, that how important is my program. My program means the program of Dr. Ornish, or program which came up in United States, and we call it Universal Healing Program. And the I now, when this is difficulty at the age of 90, that now the the rishi, the Indian rishi who taught the program to Dr. Ornish, I forget his name now, but he was he's the person who uh, came in contact with Dean Ornish, because Dean Ornish had some uh, mental problem while learning medicine, and in that while learning medicine, we have a subject in which there is nothing. You have to only remember the thing. The whole subject is such that there is no rationale in the subject. You have to remember, but that subject was you got to pass if you want to get through the medical if you want to become a doctor. One subject. So that subject, our how he learned and all that, that was the whole basis of learning the program. And I called it Universal Healing Program after practicing it and learning that it's not only curing the heart disease or coronary heart disease, but making the whole individual a better person. So that is a universal healing program, and it's really the whole subject of universal healing program. I myself is still, you know, uh, uh, what I would say that it's a program which came to us, and we made it a name. We made it a name of universal program. But I would dare say that universal. Let me tell you. I don't know how I can put it, but this universal healing program is a program for the whole world. It will solve all the problems of the world, not only coronary heart disease, but all you can say. Yeah, all what we are facing now, all problems can be solved by universal healing program. I dare say that. People will call me that what a this is such a fantastic thing, but this uh, is uh, is my what I would say that in many ways I am completely blessed. I had a let me tell you some personal thing that I had a, a wonderful partner. I mean my wife. And now I have got wonderful children. And I'm so happy to tell you that my son, who is a cardiologist, I don't have to introduce him. The whole world knows him. And uh, so uh, I don't know. Uh, let me stop here because
Thank you so much, Uncle. Really appreciate that. Uh, Talking about universal healing program, of course, I have experienced it. I've experienced it, and I personally feel that universal healing program is technically can release yourself, can make you feel very light, very comfortable, and I have personally experienced this a number of times. So I would certainly mention that. I would certainly put this in a way that anybody who's following to the universal healing program, and it's completely for the world, is for free of cost, no charges, and that's for the humanity. That's for the humanity, and I really appreciate this for this universal healing program, and I really appreciate you for giving this universal healing program to the world. Absolutely, I really do. With this, I would have a couple of more questions. Uh, they are very critical. They are really important. Uh, of course, some of them you have answered. My question was, what kind of people are prone to get heart attack? I think we took this. We really covered that one. My next question, I would love to ask about the last question. I would say you've been practicing for such a long time, and it's really beautiful. 55 years, 55 very beautiful years. So with that, what is your special message regarding heart attack to the world? What can be your special message? What can be your special message?
now a good question, but very good question. I would say that the if you want to prevent heart attack, or then the most important thing is that to understand one thing, that heart attack, very important thing. heart attack always occurs in healthy people, so-called healthy people from outside, completely healthy. You don't, all people who are completely healthy and they think that I don't have, I don't have to worry about anything, or especially heart attack, then they are in the wrong, and they should be, they should understand that if they have a family history, the family history of heart attack is most important thing to understand. And once one family history is there, then the all all people, especially the males, they should avoid tobacco in all forms. They should not take alcohol in excess, and they should follow a, a diet regime which does not have, with a diet which is not, which is fair, which is which is not in rich, which is not rich in, uh, what we'll call it, what type of fat, the fat, everyone knows, even the schoolboy knows that the fat is harmful, everyone knows it. So the important thing, but in the diet, the now you see, I don't want to say anything which is so common that the people think that the fried things are bad. No, everyone knows it. Fried things, but people fry. Then they say that this oil is better than the other oil and all that. So there's so much of, actually, I as a cardiologist and practicing still today, people still I have to control my clientele. Today I'm so happy and see that I tell them that the the type of oil you use is not important. The type of diet, So I'm not yet that special person in any way to give any message to the world, I tell you. I still, at the age of 90, feel that man full of weaknesses and full of so many, uh, I really don't know what message I can give. Only message I can give is, okay, there is nothing to fear about heart attack, and it can be prevented. It can be prevented, especially if you have a family history of heart attack. It can be prevented very simply by sticking to the rules, in the sense that checking your lipid profile and keeping the LDL cholesterol below 70 through dieting, etc. And otherwise, uh, people, when they get 90 years of age, uh, and when they have practiced for more than 55 years, and you think that I should know everything and I should be able to give some golden message to the world. Uh, I feel that I still have to, I'm not fit, and still have to learn so many things. Uh, in short, I'm unable to give any golden message for anything like that. I feel unable to do that, uh, because first of all, in the whole subject of heart disease, I have liked it because one thing, coronary heart disease, uh, I have done it. I have practiced for a long time. I have understood it. I now know it. And fortunately, I've made little name in treatment of coronary heart disease. But I, to be honest with you, I have like I have always thought of the heart in two ways, not as a disease, but in the common way of heart, which people think, the lover's heart. That also is, I think, a larger part in my life than the heart disease. That I should be very frank with you. So that my whole life, the 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 other heart, not the disease heart, has been my uh, strength or a weakness, whatever you call me. You understand? So, in short, I thoroughly enjoy uh, practicing heart. Heart. When I see a person, when he comes to me, a patient comes to me and talks to me, it is like a love affair. You understand? Uh, you feel that you are one with him. Right? So, You, uh, I tell you, the I'm so I have literature, language has been my forte, has been my strength right from my school days. And I like people who are, all the, I have all literary people have been in our, very close to our family. And Gandhiji, of course, how much I can tell you about that. He's everything, everything. And he, my teachers introduced me to Gandhiji right from my age of 10 or 12. And they say that, because how can I tell that I was in his lap when I was 3 years and 5 months or something like that. So whatever it is, but I have no, uh, I have no, I would say I would practically know uh, all the, what the Gandhian qualities, Gandhian virtues. I don't know how much I have that qualities, I, I think I, I like those qualities. I appreciate, I value those qualities. But how much I have those qualities, I don't know. I still strive to understand that. You see, so he's an ideal, and he still is an ideal, and I keep it. He's an ideal in my all my affairs of life, even today, in today, and even in my practice. And it, uh, let me tell you the last word in my practice today, as I go, you know, regularly, and I love it. My practice is, because I like that word. It's a romance. It's a romance. I go there and I meet everyone with a with as you practically, this I have not used word, as you meet your, you know, when you start loving somebody, getting, and when you meet your girlfriend, have a little love affair. So in a different way, when when I meet a new patient, or when I meet my patients who are old patients that come to me over and over again to see how they are, repeat follow-up patients and all that. My follow-up patients come for 30 years, 25 years, 20 years. And to see them, now, it's such a romance, I tell you. I think I have talked with you enough.
I would really mention, Uncle, one thing. One thing really need to I learned today from you, and that is that it does not matter what is your age in your life, but a leader would want to learn and just learn and just learn, and this is how uh, we grow. And the second very beautiful message that you have given, that get in love with your work, with your whatever you are doing. That's really excellent, and that makes you a real person. That makes you a lively person, and I really really appreciate that. With this note, I would stop here. I would say thanks to Ramesh Uncle for giving such a long time. It's Sunday, so probably yes, he could give some time to us, and I personally feel uh, that you are an asset to this country, our very own country, India. You are an asset to the world. I really admire you. I really appreciate your practice, every single word you say, and I really appreciate that you have taken a serious pain to ensure that people follow the universal healing program, because this, I feel personally, is something that people must know, must learn, and must implement in their life. Because heart attack, of course, there is nothing to fear of, but yes, the prevention is must. A very beautiful line you mentioned, that heart attack is something that people immediately die, and that causes fear within them. And of course, that's really true. And to not to be afraid of that, we must prevent that. And there are beautiful ways to prevent that. I follow those ways. I follow and make sure I follow you. I follow Universal Healing Program. So thank you so much for your time today. So with this note, we come back to our old heart, that heart thing, like that heart towards love, and we just we leave this point here, the medical point of heart attack, and would wish you all the best. We would wish you a happy life, a beautiful life. Make sure that your food habits are accurate, food habits are not uh, making you in any trouble. Live life very nicely. uh, Remain stress free at all times. It's really important. Stress is one of the causes of heart attack, and that's the reason universal healing program and implementing that is really important. So wishing you all the best, wishing you a very beautiful life, and we'll we'll come back tomorrow with some very amazing shairi. I think I do have something I wanted to write today on college podcast. So probably yes, I would do that, and I think by this means Ramesh Uncle would listen to one of my podcasts, especially the college podcast, because I think today I got to know that he also loves that the other side of the heart, that is the love side. Anyways, keep listening and have a nice time. Bye bye. Namaskar.